Many people over the age of 60 are repeatedly told that the solution to poor circulation in their legs is simply to walk more. While walking is certainly beneficial and should remain part of a healthy lifestyle, it is not the complete answer for everyone. Countless older adults faithfully take daily walks, elevate their legs while resting, wear compression socks exactly as instructed, and still struggle with cold feet, swollen ankles, aching calves, and an uncomfortable sense of instability whenever they stand. The reason these symptoms often persist is because the true source of healthy circulation is rarely explained. Poor blood flow in the legs is far more than an inconvenience. It can slow wound healing, increase the risk of infections, and in severe cases contribute to tissue damage that may eventually require amputation. It can also serve as an early warning sign that the arteries supplying the legs are narrowing, a condition known as peripheral artery disease, which becomes increasingly common with age and often develops without obvious symptoms. Many people believe that counting more steps each day will solve the problem. Yet the real issue frequently lies in a powerful muscle system that most people never think about: the calf muscle pump, often referred to as the body's second heart. Every time the calf muscles contract, they squeeze the deep veins in the lower legs and push blood upward against gravity toward the heart. Tiny one-way valves inside those veins prevent the blood from flowing backward, allowing circulation to continue efficiently. However, as we age, these vein walls gradually become weaker and less elastic. The valves may no longer close as effectively, and the calf muscles themselves naturally lose strength, particularly in people who spend many hours sitting. As this pumping action weakens, blood begins to collect around the ankles, swelling increases, feet become colder, tissues receive less oxygen, and movement becomes more difficult. This creates a frustrating cycle where reduced activity weakens the muscles even further, causing circulation to decline even more. The encouraging news is that improving circulation does not require walking farther every day. Instead, it depends on activating specific muscles in ways that directly stimulate the natural pumping mechanism of the legs. There are 5 highly effective movements that gradually rebuild the system, each preparing the body for the next, with the most powerful exercise saved for last. Together, these simple exercises require only a few minutes each day, yet can make a significant difference in circulation, strength, balance, and overall mobility. Before introducing these movements, imagine someone like Lorraine, a 71-year-old woman who remained active, drove herself wherever she needed to go, and loved spending time with her grandchildren. Despite walking a mile every day for years, she still experienced freezing feet every night and ankles that became badly swollen before dinner. She followed every piece of advice she had been given, but felt discouraged because nothing seemed to improve. Her experience illustrates why understanding the calf pump matters so much. The first movement is the ankle pump, an exercise so simple that many people underestimate its value. In fact, it is commonly prescribed immediately after leg surgery because it helps prevent blood from pooling even before patients are able to stand. By slowly pulling the toes toward the body and then pointing them downward, the calf muscles repeatedly contract and relax, gently squeezing the veins and encouraging stagnant blood to return toward the heart. Research involving older adults has shown that this simple movement improves blood flow and reduces swelling even without standing or walking. Performing the exercise correctly is easy. Sit comfortably with both feet flat on the floor. Lift the toes while keeping the heels down, then press the toes downward while raising the heels, repeating the motion slowly and deliberately. Completing 20 to 30 repetitions 2 or 3 times each day while watching television, reading, or relaxing can keep the calf pump active during long periods of sitting. Unlike ordinary walking, which often relies on momentum, ankle pumps force the calf muscles to fully contract, producing a stronger pumping action that helps warm the feet, reduce swelling, and relieve pressure inside the veins. Because they place almost no stress on the joints, they are also ideal for individuals limited by pain, fatigue, or balance concerns. The second exercise builds on this foundation by targeting larger muscles higher in the legs. The seated leg lift strengthens the thighs and hip flexors, muscles essential for standing up from a chair, climbing stairs, and preventing falls. These muscles also compress the large veins running through the upper legs, helping move blood upward more effectively. Maintaining strength in these muscles is especially important because walking speed is now recognized by geriatric specialists as a powerful indicator of overall health, independence, and even life expectancy. As walking speed decreases, it often reflects declining muscle strength and increasing physical vulnerability. To perform this exercise, sit upright in a sturdy chair with your back firmly against the backrest and both feet flat on the floor. Slowly straighten one leg until it is comfortably extended. Hold the position briefly, then lower it under control before repeating the movement. Completing 10 to 15 repetitions on each side while avoiding any rocking motion ensures the thigh muscles perform all the work. As strength improves, adding light ankle weights or a resistance band provides additional challenge and encourages further muscle development. Even modest